National Nurses Day. The coronavirus pandemic is shining a bright light on the heroic work they do to save lives.
But there's also uncertainty for the future of nursing and jobs in healthcare. KOMO's Ryan Yamamoto examines an industry that will soon face a shortage of qualified frontline workers.
Photos from the front line, powerful, emotional, and unforgettable.
When you walk onto the unit and you see the look on people's faces, and we all have that look in our eyes of we're tired, but we're going to keep pushing on.
Liam Malpass knows that look all too well. He's one of the thousands of registered nurses wrapped in personal protective equipment, saving lives while risking his own.
And many people are calling nurses heroes right now.
Yes, they are heroes.
Azita Amami, dean of the UW School of Nursing, calls the newfound recognition a blessing. The 8 p.m. cheers for healthcare workers and the acknowledgement from the community, she compares it to the respect and admiration firefighters received after 9/11.
This pandemic had to happen for the nurses to be recognized and noticed for their job.
The recognition coming at a time when the nursing industry facing a future shortage. The Bureau of Labor Statistics estimates a shortage of 200,000 nurses by 2026, with 1 million nurses projected to retire in the next 10 years. But many hope the positive light shined will create more interest in healthcare, even a spike in nursing applications.
I would hope that more people would be joining the nursing field.
Alia Ishmael is a UW nursing student who graduates in June. She says the pandemic opened her eyes to how dangerous the job can be, but she's never wavered about eventually walking onto the front lines.
I've never been more sure of a decision I've made.
And many are sure the pandemic could lead to more jobs in healthcare, much like the TSA was born from 9/11. Already we have temperature screenings at Payne Field, where health checks can become the norm at airports, border crossings, restaurants, and large gatherings.
In many parts of the world, we are seeing the expansion of the role of community health workers, and they're people who get specific skill training to carry out tasks.
Public awareness would increase that what nurses could do, because already, you know, a person graduating from nursing programs could work in many different fields.
Learning how hard the coronavirus outbreak has hit long-term care facilities across the state. We asked the state to look into the numbers after the deadly outbreak at Life Care Center of Kirkland. KOMO's Cole Miller live tonight in Seattle, breaking down the new information just coming in.
Well, Preston, these numbers from the state's Joint Information Center paint a better picture of the problem. We've learned that 36% of nursing homes have reported at least one case of COVID-19. And when it comes to deaths here in Washington, long-term care facilities make up more than half of that grim total.
I know they'll do the best they can to contain it.
When a respiratory outbreak began to spread through Life Care Center of Kirkland,
it could be, you know, they were already sick. It could be the flu. It could be just a cold.
it would quickly become apparent this was no flu, no cold, but a novel coronavirus taking hold, ultimately killing more than 50 residents. Since then, the Department of Social and Health Services, which regulates and oversees long-term care facilities, has shifted its entire focus to COVID-19.
So it was a lot of unprecedented situation.
And now we know that there have been at least 2,894 cases of the virus at such facilities, making up 19% of the state count and 507 deaths, 61% of all those in Washington. The State Department of Health says those cases could include residents, visitors, and staff. DSHS says 94 assisted living facilities, 76 nursing homes, 51 adult family homes, and 30 supported living providers have all had at least one case of COVID-19. To this day, work continues to get adequate PPE to those centers, and now a new hurdle has emerged.
You know, another challenge has been COVID positive patients coming out of hospitals and getting them into a long-term care setting, because understandably facilities are reluctant to take them.
Buying a car is a very emotional purchase. People want to touch and feel and drive the vehicle. It's a significant investment. And without the opportunity to do that, I think it's just going to delay people really wanting to get out and purchase vehicles.
Now that they have the chance to bring back customers, car dealers say the rules in place make little sense.
I would say it's frustrating now to see this final version of the safety protocols I just think it's going to be frustrating more for consumers.
Car sales can resume if dealers follow certain criteria set by the governor's office. First, shopping around has to be done online or by phone. So does the walkthrough on financing, warranties, and trade-ins. When a customer is ready to buy, the car gets disinfected. The only face-to-face is when the paperwork is signed. Then the customer drives away. But left out is any provision for test drives.
I just don't know how we're really able to sell without allowing a customer to drive a car.
Carrie Oldman says early talks with state officials seem to point to having customers test drive vehicles by themselves, with the car disinfected afterward. KOMO News pressed the governor's office for answers. A spokesperson says, "We are hoping to allow test drives with health requirements, but that language is still being finalized."
It is a big oversight, and like I said, I'm hoping it was just a miss, but hopefully we'll get some new guidance soon.